I'm Dr. Rajagopal, and today I'm going to be talking about Asian breast augmentation. Since my practice is here in San Francisco, we have a very large Asian population here, and so obviously I have a lot of Asian patients. There are some characteristics that are unique to Asian patients. Generally, when patients come in for a breast augmentation surgery, Asian women, they tend to have what's called a tight skin envelope. That means the breasts are, not only are the breasts smaller, the skin is very tight, does not have a lot of sagging tissue or easily stretchable tissue, and usually they're pretty slim and petite. And so we really have to take these considerations into when we do Asian breast augmentation surgery. The important thing is, since they're so petite, a lot of implants really need to be customized to them. You have to take into consideration not only their height and weight, but their bony characteristics, so that you don't put an implant that looks too big on them. Another characteristic that I found is that generally with an Asian body frame, they are relatively slim. They have slightly smaller breasts and a lot of times slightly smaller buttock area. And so the other important consideration is, when you're choosing implants, is not to make them look what I say top heavy, is so not just to focus on the breasts themselves and forget the rest of the body. So if you put a very large implant in an Asian woman and she looks attractive from the front view, but when you see her in profile or walking, if her buttocks are very flat, it throws the balance off. So that's another important consideration. When it comes to actually choosing implants, you can either choose saline or silicone. Both implants seem to do very well in Asian women. And I generally tend to go behind the muscle in most instances, because most Asian women are slimmer, do not have a lot of fatty tissue or breast tissue. Most Asian women also, luckily, do not have a lot of stretch marks, but behind the muscle seems to do very well. Incision-wise, the two most popular incisions are either underneath the breast area or underneath the nipple crease. And both of them have their plus and minuses. As a scar, the incision around the nipple seems to heal really well. But the negative is that you do actually cut through the breast tissue and the nipple tissue, and so it can affect sensation. There are also some reports that making incisions through the breast gland, that is through the nipple and through the breast gland, can increase one of the complications of breast augmentation surgery called capsular contracture. So the other option is to go underneath the breast crease. If a Asian woman has a nice developed breast crease, then that is actually a very nice option, because the incision is hidden underneath the crease, and especially with an augmentation, the crease is further hidden. Surgery itself is done as outpatient surgery, where the patient comes in the day of surgery, has the surgery done, and goes home the same day. Generally, all the breast augmentation surgeries are done under anesthesia, and it takes about 2 hours or so. So for those 2 hours, the patient is asleep. Then she wakes up. She does have to have someone take her home. Generally, time off is approximately a week. We do send patients home with prescription pain medication, similar to Vicodin. Most women need it for the first several days, and then they can quickly wean off. The breasts look the best after about 6 weeks, anywhere from about 6 weeks to 3 months. It does take that amount of time for the skin to stretch and the implants to settle, and for a woman to have beautiful breasts.